Hello guys, sorry, can you see me? So very good evening. So I hope you have gotten your PG ranks, and I hope you must have started choosing what you want to do for a career, right? So I'm going to talk about pathology as a career, fine? Hello, good evening Babita. So myself Dr. Ranjith, I am a consultant pathologist and I teach for Unacademy Pathology, right? So I'm going to be very straightforward. Sure, Abdul. I'll just talk a few things, then you can put on your queries, and definitely I'll be trying to answer all of your queries. If I have missed something, do ping me later on, I'll answer that as well, fine? Good evening, Ganesh, and good evening, Harry, fine? So I'm going to be as blunt as possible because I don't want to sugarcoat anything. I'm going to say the right reality, whatever will help you in deciding your career, right? I'm not going to say this is the best and everything. It's going to be the frank reality, what I'm going to see in my real life. I'm just going to convey it to you guys, that's all, fine? Okay, so first of all, before deciding, I want everyone here listening to it, or everyone who wants to choose pathology as a career, to think, right? So what has happened for us is, right from your starting of MBBS, you must have had a dream. Like everyone would have had at some point of time, you must have had a dream. If seeing patients was your dream, like some of you must have not decided, okay, I want to become this, I want to become that. Some of you would have felt that, okay, I want to see patients, I want to do a surgery. If that is your dream, pathology will not have any connection to the patients. That's the first thing I want you to remember. That's the reality. I can't change it, right? So you are going to come in the back end, you're going to diagnose, you're going to help in the management. You will not be the person who's going to face in the management, fine? I'll answer NEET PG, just wait for some seconds, a few minutes, I'll present few things, then I'll definitely answer all your queries, okay? So keep that in mind. If that is the case, I would say this is not the right path. One more thing, most of you, few students ask me is, once they join pathology, can I do a DM clinical hematology later and join my see patients, right? Again, this thing is a dilemma. Like, I like seeing patients, but unfortunately the rank didn't come as I expected. So can I take this as a career? One, yes, you can do it for sure. I'll tell the problems in that, right? What happens is, for 3 years you will not have a touch with the patient, so you might get lost there, right? You might totally leave seeing patients, so that might be a bit of risk, fine? Second risk is, as of now, NMC has put that MD pathologists are eligible for your DM clinical hematology, right? They're eligible for DM clinical hematology, but I don't know what will happen in future. Because when you see in the past 4 years, they removed it, they included, they removed it, they included, right? So I'm not sure about it, fine? So keep that in mind always. And the third thing is, now the NMC has changed the NEET super specialty examination pattern. Previously, when a person wants to apply for DM clinical hematology, he needs to know only hematology. Now, predominant of medicine also will come into place. So for a pediatrician or a biochemist or a DM clinical hematologist or a pathologist going to DM clinical hematology, the NEET super specialty exam might be a little bit difficult. Again, this is based on the current scenario. I cannot predict what is going to happen in future, what they're going to change, right? This is what is based on my current scenario, fine? Okay, Disha, good evening, and Sunshine, definitely I'll come to that just a few minutes, fine? Okay, next thing. So what is the difference, or the difference between your medicine, surgery, orthopedics, fine, and your pathology, fine? Yes, David, as of now you can do it, okay? In future, I'm not sure what will happen. See, when you do any MBBS career, you must have done case history for medicine and surgery, orthopedics, pediatrics. You must have done an examination. I know the preliminary examination of CVS, RS, everything. I know what to investigate when I'm going to have this. So when you go to a medicine or a surgery or pediatrics or OBG, whatever it is, I have a fair enough of idea what I can do it, what I can do, what I should do. What I had to do in my MD is refine the idea, make it perfect, and have the confidence of management. That's all. So for every clinical subject, whatever you know, I do have a little bit of base. But for pathology, I will not have a base, right? Again, just wait for some time, I'll definitely answer your queries. You must have read about pathology in your second year as a theoretical subject. That's totally different from what I'm going to see in practice. This is what our scenario must have been like. Left corner was broken, so that was a diagnosis in your practicals, right? So when you come to a pathology, the learning curve is going to be extremely high. I'm sure all of the fresh passed out MD pathologists will accept this. The learning curve is extremely high because I need to know normal of every histology under a microscopy. I need to understand abnormality of every organ because I don't have subspecialization much in pathology. A pass out of pathology is expected to diagnose everything, right? So those might be a difficulty, those might definitely be a challenge. Pathology during residency is not a 9 to 5 job. There's lots of work will happen after 5 o'clock. You have to see slides for next time. You have to gloss. There are lots of things after 5 o'clock as well. It's not just a 9 to 5 thing. Second thing, this learning curve is much steeper, and it's not a subject where I can just sit here, leave and go. You have to invest lots of time in reading. If you're a nerd, if you're okay with that, please go with pathology, right? It's not an easy one. It is definitely difficult, but it's not like it's not doable. You can excel if you have the persistence in reading, and you have to keep on updating, right? Next thing, this is one more question your students ask me. I'm just answering all the overall questions, then definitely I'll take care of all your individual questions, right? What do I do, MD or DNB? What to choose? Fine. So I would always suggest this for every student. When you're going to do an MD, I would say a first tier city, or if a second tier city, a very good established hospital, government or private, whatever it is. Because for pathology, unlike medicine and surgery, I need equipments, I need cases. Then in the first tier city, or maybe in second tier, if it's good, there will be definitely, that a second tier city, a hospital or a college is not so good in the sense don't have much patient load. I will put them later, right? The next choice for me personally will be DNB. Again in cities, metropolitans, DNB. Then later I would say MD in a peripheral college. Okay, this is totally a personal view. Why I have kept like this is, why I have kept DNB above an MD in a peripheral college. The same thing, when I'm going to have pathology, the sample coming inside, let's say leukemia, you must have learned about leukemia, right? So when I say leukemia, I need flow cytometry, I need CD markers, I need immunohistochemistry to diagnose. That's the bread and butter when you come outside. So an MD in a peripheral college might not have everything. But DNB, let's say Apollo will have everything available. Apollo has still next generation sequencing. That is the latest thing, right? I know about Apollo Chennai, so I'm confident about that. They have even next generation sequencing. So Apollo, like a DNB in a very good hospital, has everything available there. So you need not go and later have a training. You'll have a basic idea. Then if you want to specialize something, you can go ahead. But when you finish an MD in a peripheral college, which has a good caseload, but everything I'm going to diagnose in a microscopy, I have not seen IHC, or I have limited 10-20 IHC, that's all. So then what I have to do is, you have SR becomes must, because experience will be a little bit lesser. So this will be my order: MD in a very good college, first IHC, government or private, whatever it is, then your DNB, then I put an MD in a peripheral college, right? This is what I would advise. Having said that, there are few stigmas in MD and DNB with respect to government job. In private job, there is definitely no stigma. In private, in corporate, what they're going to look for is how good, how efficient you are. If you prove yourself efficient, MD versus DNB, in job wise, whatever I'm seeing in real life, there's not much of a difference. Government recruitment, slight difference is there. People who look down, maybe slightly they look down, they're old people, right? Ignore them, right? That's not going to be main choice to differentiate MD and DNB, okay? Next. So DNB hospitals, what should I look for? It's like, keep this as a checklist for anyone who's going to go into pathology. The first thing, what I want is caseload. Caseload is extremely important, right? Let's say that you are going to come outside and you're going to practice as most of the time hematologist or an cyto or an histopathologist. Whatever said and done, if I'm seeing like say 3 bone marrow aspirates every day for the 1 year of my hematology posting, I'll be very comfortable, right? That's good amount of bone marrow aspirate, good amount of exposure. So caseload is the most important thing to look after. Second thing, as I said, infrastructure. So infrastructure becomes extremely important for your pathology. Might not be important for medicine. I need patients enough for me for medicine, pediatrics, OBG. I don't want the hi-fi infrastructure. But infrastructure in the sense, do they do IHC? If so, how many? Do they have flow cytometry? Yes, definitely an added advantage. Do they have genetic diagnosis? Yes, if so, definitely an added advantage. These are things you're going to look for when you search for an DNB hospital. The third one, teaching facilities. Okay. See, one thing I would say that it's not like your medicine or surgery. There will not be much of a competition here. Why DNB is a little bit looked upon is when you say you're going to have a patient in Apollo, or I will not take any hospital, in a corporate hospital, then it is DNB. The surgeon, the main surgeon, will be a little bit hesitant to let a junior handle the case because the reputation is there. But when it comes to pathology, there's no patient interaction. So first, I'm not going to have a problem. and you are not going to sign it out. You will be there and the teacher will teach you. Definitely if the person has teaching inclination, DNB, I won't have shorts of resources if these two are available. This is not a problem compared to your clinical other clinical subjects, right? So here, so one more important thing what I want to comment on is, many of you are worried about the pass rate in your DNB exams, right? So I want to break this out to you guys. See, the only thing in DNB is, it's not the pass rate. See, I'll tell you what happens when I'm having MD. Let's say I've done in my college for 3 years, I've done in my college. So I'll write an MD exam in my college. So my HOD will be there for sure. So my HOD will not worry much about my that day presentation. If I goof up some case on that day, she or he might have known that, okay, this guy has done the last 3 years good. They will have a fair assessment about myself. So the answer or your passing will be based on that, not the day's performance alone. But the problem in DNB is, I'm going to go to a different state. It's a centralized exam, different state or a different hospital, and I'm going to write. So the person who is going to examine me, judge me, is going to judge based on the 3 hours exam what I give. That's all. So if I don't do well there, the person will not know what I've done in the 3 years. That's the only difference between an MD and a DNB. So you won't have the home hospital or your home college advantage. Apart from that, everything is same. You do well, you're confident, you diagnose well, definitely you answer well, you will get a good pass rate, right? It's not very difficult like it is being projected. The only difference is the home college advantage is not there in a DNB. That's all. Fine. Okay. So what you will learn in pathology? You'll have lots of things to learn in pathology, right? The major categories are hemat, cyto, and histopath. Again, for everything to start with, you need to start with basics. Right? I started particularly for postgraduates classes in Unacademy. You can join there and see whatever videos you want. It's from basics. Not only that, I need to know about techniques. I need to know how to slide, how to stain a slide, how to interpret a slide, how to cut a slide. Everything I should know about it, right? So as I said, that it's more academically strong branch. You have to be very academically strong to excel in pathology. Fine. Next, type of work. See, there are multiple types of work. Like I will be involved in histopathology, something called grossing. So I'll tell you what exactly grossing is. When a surgery is done, post-surgery, let's say a Whipple's procedure is done, it comes to the hospital. So when it comes to my hospital, when it comes to the lab, I'm going to look at the Whipple specimen, say that, okay, it's properly done. I'm going to see the tumor. I'll cut a little bit of the tumor, right? And I'll give it for microscopic assessment. That's grossing, right? Then it might not be in every hospital, but in most of the hospitals, FNACs are done by the pathologist. In few hospitals, the surgeon itself does the FNAC and gives it, right? If FNAC is done, yes, you have to do the FNAC as well. Apart from that, you'll have reporting. Most of the hospitals in the morning, you'll have reporting with the consultants who is reporting the case. In the afternoon, you'll do grossing or whatever it is, fine. If it is a teaching college hospital, okay, it's a teaching college or wherever the undergraduate is there, undergraduate teaching becomes an important thing in your routine curriculum. Right? You have to guide them in the practicals. You'll have tiny batches where you have to guide them as well, right? This is not a part in your DNB program. As I said, that the only reason why government jobs are a bit scary is most of the government jobs where you recruit a pathologist, that will be linked with a medical college hospital. If you don't have much of a teaching experience for an undergraduate, they'll ask you to do an SRship outside 3 years, then come inside. That's all. That's the only difference. That's the only difference. Government college little bit is less for an DNB person to enter inside. Okay. I'll come to all your questions. With this. So what do I do afterwards? These are important for your current MD pathology as well, right? The scope of pathology is ever expanding. You have lots and lots of opportunities. You name an organ, there's fellowship in India. MCA recognized, MCA not recognized also. We have fellowships. First of all, we have DM. Okay. So in DM, like I said, that one opportunity is my DM clinical hematology. That's there. DM oncopathology, DM hematopathology, and there's DM histopathology in PGH Chandigarh, right? So DM oncopath is there, hematopath is there. Hematopath is there in quite a few places, and I have DM histopath as well, right? I have all these types of DM. If you want to do a DM, right? If you think that I don't want to spend 3 years in reading, go for fellowships. There are lots of fellowships options available. You have fellowships for, like I said, each and every organ. I have fellowship for cytology alone. Indian Academy of Cytology gives that. Genetics, I have fellowships. I have fellowships on molecular genetics. That's there in both in corporate hospitals as well as in good colleges. I have genetics for fellowship for GA pathology, renal pathology, hematopathology, liver pathology. There are lots and lots of fellowships available, right? There's no scarcity of fellowship. and there are few courses called as PDCs. PDC stands for Postdoctoral Certificate Course. The main difference between PDC and my fellowship is, fellowship in some places will have thesis involved. PDC, the certificate courses, might not have thesis, and almost every PDC is 1 year. Some fellowships can be extended up to 2 years, right? These are things I can do outside, right? So coming to this may be a redundant question. The answer is big no. It's not only for pathology. In our country, AI will not replace any medical science in the near future. Don't worry. You may be working for next 40 years. You don't have a threat for your job for the next 40 years, at least in our country, in the current rate of growth. If it alters, let's see what to do. Fine. And the most important thing you must have all you ask is, how much do I earn, right? Because earning becomes an important thing for almost every one of us, right? So this is for everyone who's watching. I'll answer your questions actually just a minute. When you compare, there are lots of my friends, my colleagues, many one say that you must have seen in your Facebook post, like, the worst decision for me is taking or getting into an MBBS. The settlement is very, very late, right? We crib a lot because of that. I just want you to have a different perspective, right? So let's say that you're finished in MBBS and you're getting into a hospital for a 6-hour duty. Am I right in saying that almost everywhere the minimal pay will be 30 to 35,000 for 6-hour duty? And if you do for 12 hours, you might get a little bit more, right? Let's assume for a 6-hour duty, some places you might get a little bit high, some places a little bit low. On an average ballpark of 35,000 as a fresher finishing your internship. Yes, as of now, that's the scenario. So when you take that and compare to any other stream available, no other stream will give that, fine? No other stream will give that, okay? Okay, just a second. I hope it's fine. Is the voice fine? Is the voice fine? Just let me know if the voice is good. Okay, great, fine. So no other stream of your career apart from MBBS will give that, right? So we'll keep that aside, keep that in mind. So now let's come to how much a pathologist will earn, fine? I'll tell you the frank reality of the market now. I will not be able to say what will happen 3 years down the road, what will happen 5 years down the road. That no one else can predict, right? So as of now, a fresher, like if I'm going to put out a ad for a fresher in my hospital, the basic pay will be 80,000 per month. Fine. I'll tell what are the probabilities. So hospital will hire for a basic of an 80,000 per month for a general person, right? You can get associated with a medical college. I'll come about and talk about your saturation also, fine? When you come to a medical college, again the basic pay will be around 80,000. Fine, that will be the basic pay. Okay, so in medical college, the saturation when it comes, most of the times the saturation will be in a city. Like I'm in Chennai, getting into a medical college in and around Chennai will be difficult. But 150 kilometers from Chennai, there are still vacancies available. Same thing for every metropolitan city. The thing is, everyone is crowding in the metropolitan city. So for not only for pathology, almost every field, there's a little bit of saturation in a metropolitan city. Delhi, yes, you won't get a college. You go a little bit outside Delhi, you'll have colleges. Same with Mumbai, same with Kolkata, same with Bangalore. In the center heart of the city, medical colleges in and around like 10-15 kilometers around that, difficult. 80-90 kilometers, second tier city, there are still opportunities in medical college also. Again, I will not be able to say what will happen 3 years down the road. But hospitals, this pay is for a corporate hospital in a metropolitan city, fine? That's a starting pay. So second opportunity is, can I do 2 jobs? Okay, because I want to clarify everything, because there are lots of people who are advising on Facebook who really don't know the reality, right? So doing 2 jobs is hectic. It's really hectic. I'll tell you why. So when a hospital pays you 80,000, they'll expect you to be from 9 to 6 p.m. at least. Okay, from 9 to 6 p.m. definitely they'll expect you to be there. They'll definitely expect you to be there. They're not going to let you by 3 p.m. There are very rare instances where you can let you by 3 p.m. That's all, right? So when you work from 9 to 6 p.m., after 6 p.m. to 9 p.m., if you get a job in this timeline only, you can do a second job. Otherwise, it's not possible. Again, the second job might not be possible at the start of your career. So I'll tell you how a job opportunity is going to come to you. You work in a hospital, you have your network in the hospital, you talk with the technician, you talk with the other people, then only you know that okay, there's a part-time opportunity here. So once you finish an MD, you cannot have 3-4 jobs in your hand. But yes, after 5 years into MD or 4 years in MD, you will have more connects. Then you can say that okay, I will not work for 9 to 6 in your place, because my work requirement is this much only. I can report this, finish every work here, I'll be there from 9 to 2, I'll leave it. That happens when you're experienced, not when you're a fresher. Remember that going for a multiple jobs, not only for this specialty, every specialty, it's possible when the hospital knows that you are good, and when the hospital cares that if you leave, they'll have a lacunae. Only then go for the second job for every specialty. Otherwise, the hospital say, okay, this guy is going for a second job, we'll check him out, that's all. And you have to prove that you're good, right? Third, starting an own lab. Okay, I think I would be a better person to comment on this because I did start one, I burnt my finger, so I'll definitely be able to put a lot of experience into it. See, starting an own lab is not an easy job at all. It may be very lucrative when you say that okay, this XYZ lab was bought for 1,000 crores, 2,000 crores valuation. That's totally different, right? So if you already have a hospital and a lab, perfect, that's it. If you're a fresher with no background in business, starting a lab has its own hiccups. It'll have much more hiccups than your consultant job in a hospital, fine? Not only that, when you start a lab, most of the people think that okay, I'll start a lab, I'll work for like 2 years, establish the lab, then I'll be the boss, I'll sit back and relax. No, this is not true for any business. When you're going to be in a business, like starting in a lab or in anything, chain of lab or anything, the amount of work you're going to put inside will be more than the consultant job. That's a reality. If the dividend is more, work has to be more. If you're not able to work more, dividend will not be more, that's all. You might not be physically present, but when you start a lab, from 8 a.m. your lab starts till your 12 p.m. or maybe 10 p.m. when your lab ends, you should be on call. Any problem happens, you're going to be responsible. Your employee goofs up, you're going to be responsible. Report goes wrong, you're going to be responsible. And in a place where customer is more important, like XYZ, when you guys are frustrated against some person, you write a Google review, right? Same thing your customer also will do. You have to take the phone and talk about it. The doctor will shout, the physician will shout because something is not happening correctly. You have to handle everything. So starting an own lab has its risks. At the same time, if you are able to put the risk, has its dividend as well, right? So again, that's a possibility. It requires investment and it requires proper planning. How to run a business, you have to know about it, right? That will not be taught in your MD, MBBS and MD. If you're a born entrepreneur, yeah, you can go ahead with starting a lab as well, fine? Okay, so as I said that, how much will I get and raise? The 80K HO is a basic thing, right? So let's say that a 4-year to 5-year-old pathologist, an average person who's staying in the same place, not doing much, right? There are people who can grow, like some people's growth phase will be like this, gradual growth phase. Some people can grow like this, right? So I'm talking about a gradual growth phase. 4 to 5 years into the lab, you can get about 1.4, 1.3 to 1.5 lakhs. You don't do anything, you sit there, you get experience, that's all, fine. If you're good, you can switch jobs, you can prove to the hospital or whatever place you're working that you're more worthy. Definitely, you can, in 4 to 5 years time, again you can go to 2 lakhs approx, fine. Again, this will not be the cup of tea for everyone, but yeah, 1.3 to 1.5 lakhs. As on date, it's possible for a 4 to 5 year experienced pathologist. More than 10 years, again, it depends on your skill. If you're not going to increase your skills, the pay also is not going to increase. It will become stagnant, right? Again, if you're not going to do anything, you may earn up to 2 lakhs. If you can do some things, you can improve your skills. You've done a fellowship, you've done a DM, you've done a specialized course, and you're more valuable to the hospital, you can go up to 3 lakhs. Fine, is up to more than 10 years. After that, kind of becomes stagnant. I'll be very frank. Beyond this, for a person who just does normal thing, 2.5 lakhs will be the maximum per month salary. A person is very good, it can go up to 4.5 lakhs. Fine. This is in reality what happens as of now. Again, that requires experience, that requires time. This is for a single job. If you want to do juggle between 2 jobs, 3 jobs, work more, that's totally different, right? And when you start a lab, that equation totally changes. You can flop as well as you can become a super hit. both are possible in lab. And more things, there are definitely, this will become signatory authority. Because I do know lots of people who are just signature authority, which means they will just sign the reports, that's all. Which means I don't want to go and present in the lab always. If there is some slide review, I'll go and see it, that's all. Okay, I'll answer your question, Vikas, right? Just signature authority. These are also possible. There are many labs which are technician run. Is it right being a signature authority? Totally wrong. It is wrong. It is not approved by NMC or MCA. If you get caught, it will be your own thing. I would say don't go for that most of the time. Fine. Signature authority, I'll tell the pay as well. 1 hour, come to my lab, just see the slides, whatever is there. I'll take your signature. This is what the signature authority deal most of the time goes. It'll be around 25,000 to 35,000 per month for 1 hour. This is routinely done in most of the not in the even in metropolitan cities or in second tier cities. There's two small labs which will not have much of inflow. They'll pay you this much, right? So these are regarding your earnings. This is from a practical experience. Whoever is getting it, I'll be able to say, fine. So this is what I want to talk about pathology. Now you can ask me your questions. I'll be able to answer. First, I'll take Vikas. Because if you love pathology for reading and if you're not able to see slides, seeing slides is going to be the routine throughout your life, right? Reading pathology is totally different from implementing it and giving a final diagnosis. I don't know how did you judge from seeing slides, because what you gotten exposed in your second year is nothing related to pathology. There are lots and lots of things. If you are really sure about I'm not good at seeing slides, I don't like seeing slides, then I would say that give it a second thought. Fine. Okay. There are a few more questions. Okay, Ayushi, MD Pathology from a private or a DNB? Private is not so good. Again, see, Ayushi, the thing is, MD Pathology from a private hospital, it totally depends on what hospital you're doing. Manipal is a private hospital which is extremely good, right? Ramachandra is extremely good. There are a few private hospitals that are extremely good, fine? So depends on what hospital you're choosing, and the same thing goes with DNB as well. Apollo, Stevens in Delhi, they are very, very good DNB places, right? So it depends on what you're choosing. Amongst that, I would say choose wisely. Okay. Francis, no, there is no patient contact in pathology, right? You will not be exposed to patient unless you're going to do a FNAC. That's the only place you'll have patient contact, right? Disha, again, DNB clinicals versus MD Patho. The thing is, as I started with, if you want to see patients, if that is your goal, I would say go with the clinical subject. If no, I don't have any preference like that, I'd say if MD Patho you like, go with that, fine. Dr. SJ, 22,000 MD Pathology in Stanley or CMC value will be difficult. With the last year's counseling result, it will be difficult. But I'm not sure how much the combination of DNB counseling and AAPG will have an effect, so might be there. Francis has said that DM clinical hematology is a possibility, but I would prefer, if you're going to go to DM clinical hematology, prefer MD medicine, and that will be a better route than going to MD patho on that, right? I'll tell the orders. I have few of the states orders. I'll just tell them from some time. Okay, will I get a job from after 3 to 6 years? I really am not sure about it, fine. So if after 3 to 6 years, what will happen? No one can answer at this point of time. When it comes to saturation, there are opportunities definitely opening up. See, when it becomes saturated, what will happen is the same thing happens with every subject. When it becomes too much of saturated, they'll start bifurcation. So it will come to a place that I don't want an MD pathologist. I want a person who's done a fellowship in oncopathology. That will happen, but I don't think so. Job will be a problem for everyone. If you are not okay, if I have saying that I'm in a metropolitan city, I need a job within 10 kilometers from the home place, that might be difficult. You will be willing to relocate. If you're willing to relocate, jobs will definitely be there. I'm not able to understand your question, Sunshine. Can you rephrase it? Any clinical batch in any rank in private? No, there are few things that end of the after third counseling, if seats are vacant, that will come back to the management pool that you can take. I have few orders in few states. I'll definitely put up. Okay, Leela Joseph, you want oncopathology, the best place will be TMH. There are few hospitals which are very, very good. HCG in Bangalore is good for oncopathology. There are few onco related hospitals. You can do a fellowship there, or you can do a MD or DNB there, fine. Monisha, 25,000. As per the previous All India counseling, it might not be possible to get in a good private college. Saurav, scope of government jobs, that is totally left to the government. If they announce something, which I'm sure it's dwindling day by day, hopefully in 3 years down the road when you finish, if it is there, you might get an opportunity. Most of the time, no. Usha, VMMC is a good college. You can go ahead with it. Just a second. Abhi, not interested in teaching as of now. Can I get a job after completing MD or bond? Yeah, you will definitely get a job. As I said, that if you're willing to relocate, you can go with it. Niranjan, yes, JIPMER Pathology is good. I did from JIPMER, so you can go ahead. There are few lacunae, but definitely you'll overcome that. The load is a little bit higher. We have a good spread of IHCs. Flow is there, and you can definitely go with that. Okay, Sagni, that's one problem for most of us. Like as I said, the learning curve is going to be extremely deep because we were not exposed as an MBBS into pathology. What we saw was few slides. So if you're okay to put up the struggle and to learn with the same interest, definitely you'll be good in studies, good in slides. If I'm not okay with that, you're not going to be good in slides. That's all. It's totally based on your thing. And as I said, that it's not impossible. The curve is steep. That's all. It's not like other subject. I go there, I already half know. Here I don't know anything. So the curve is going to be steep. If you're okay to read that and pursue that, you'll definitely become good. Anu, 31K, as the last closing rank of AAPG 2020 was around 28,000 in DNB. Might be a bit difficult. Maybe not, right? For both of you, 31K, that was the closing rank last time. Okay, epicness overloaded, good name. Scope and research. Scope and research in our country per se is a bit less. But yes, once you finish an MD Pathology, if you want to go abroad, there are definitely scopes in research. Most of the research stems from basic sciences only. PATH is a good field for research. You can definitely apply for an abroad thing. You will have a good thing outside the country. In our country, bit tough. Because 20K, again, as I said, that it's difficult. Last year, 22,000 was a pathology closing rate. In a government college, might be a bit difficult. I'll definitely tell about the DNB PATO. Okay, Madhushri, MLE is totally a different ball game. If you finish your MD and get an MLE, you will have a bit of an advantage compared to an MBBS and MLE. So yes, MLE is definitely a possibility. FRC path, you can clear. It is 2 parts. First part is very, very simple. Second part, if you put some effort, it will clear. It's not, both of them are not difficult exams like you NEET PG, fine. Like you can work abroad, but you should get qualified in whatever examinations they have in different countries. Abhi, yes, SRship, again, it totally depends on where you're doing SRship. If you want to do an SRship after some MD in a peripheral college, I would say that choose a good place like AIMS or JIPMER or PJ or Tata Memorial, where you're going to put your heart and soul and sit for the SRship. So definitely you can make it out. Okay, Tushar, genetics, you do have, again, research is something which is bit rare in our country. There are very few places which are research. You please ping me, I will tell you where to go for research, whom to contact for, with the contacts I know. If you're able to go abroad, yes, definitely there is a good scope. You can go Maria to abroad, but again, UK, you have to clear their own portal. Once you clear that, you can go. Okay, Gandhi, 16,000. Okay, becoming two questions, like college in Tamil Nadu, which is good. If you're okay with DNB, I would say prefer DNB because you'll have a better scope in that, because once you go to 16,000, it might go to a peripheral college in MD. And chance of becoming a professor, yes, it is there. Entry part is difficult. See, what happens in every subject is, when you're going to enter into a medical college, you might not get vacancy because lots of crowding. After 5 years, no one wants to sit in a medical college. That time, professor opportunity will be more in almost every field compared to your tutorship or an assistant professor. Fine. Bangalore Medical College is a good one. Mysore Medical College, I'll put little bit later in Bangalore Medical College. Fine. I'll just give I have few states I've listed it out. I'll just tell you. BJMC Pune is a good college. You can go ahead. Priyanka, I will not be the right person to give the pros and cons of MD microbiology. I'll definitely have some other educator definitely giving on that. It will not be correct if I give both something which I don't know. Yes, Abhi, you will definitely be able to get it. Don't worry about it. How to classify TB according to PATO. Okay, progress. We will read about the content lectures sometime down the road. This is for people who wanted to decide a career. Definitely we'll have that down the road. BGMC Ahmedabad is a good college. You can go ahead with it. Krish, MD in a metropolitan city, DNB in a metropolitan city, then MD in a peripheral college. That will be my take. I'll tell you Neha just a minute. 15K might be a bit tougher because BMC goes a bit ahead than 15K. Mysore Medical College might be possible. I'm not able to understand your question, Evangeline. Diploma in any clinical branch need SR? I don't know. I'm not able to get what you're trying to ask. Can you rephrase it once? MS and MCG oncology, it's totally different branch. Definitely oncology will have a very, very bright future. Whatever field you're doing, it's be it patho, be it medicine, or be it surgery. Yes, so then you can do it if you have a financial background. If you want to set up a lab, yes, you can set up a lab. But doing a lab and a private practice and working in a college might be too much in a kitty. I would say that if your main focus is the lab, maybe join as an AP, do a little bit of work there, concentrate more on your lab, right? Because if that is what you're going to dream in future, concentrate more on that. Don't do everything, because jack of all trades, at the end of time, I don't want to get overworked, stressed up, and leave everything, right? Keep one as a thing. AP is going to give you an initial push for you to have your income regularly, then concentrate on your lab. IHC is there, flow not so much. Kasturba Medical College, Manipal, it's one of the best colleges for pathology, not only for pathology, for almost every subject. Yeah, if you get it, definitely go ahead with it. Abhi, like for everything you're going to go abroad, there will be lots of exams, entrance portal views. You have to get through their portal. Again, having said that, it's not a difficult thing, but yes, the journey might be a bit longer. Some places don't accept our degree, so you have to do something in there, like USMLE. Even if you do an MD Pathology, you finish here and go there, you have to do the residency again. So that might be there. You can enter any place after your MD, right? Just a second. Yeah. Okay, Gopi Shankar, Patho and Pharma is different totally. Patho, I would say, yeah, you will have scopes. Pharma, I'm not the correct person to say. Definitely Pharma will have their own different scopes. Pharmacologists will be able to comment on that. So just go through the videos, what a pharmacologist want to say, compare these two and take your decision. Okay, if you're going to do a diploma, DCP, especially in pathology, I would say that that is not the correct way to go ahead, because what happens in DCP is you will not be given slides. It will be predominantly hematology, a little bit of clinical pathology. You won't have histopathology in your cytology in focus. So diploma in clinical pathology, I'll say keep it behind. I would say better to avoid, right? Okay, loading happiness. Dermatopath is a very, very super branch in US, because we are in the very transition period. In our country, dermatopathology, there's one person in Mumbai who's extremely famous. Others, they are not much worried about. What happens is, in a developed country, everything they want evidence-based medicine. But what happens in our countries, most of the dermatologists treat the patient on clinical basis. They will go for a biopsy only when they have a difficulty. So I would expect, if we grow in the same pathway as US, 10 years down the road, dermatopath will be a super specialty. But having said that, it's a niche field. Might happen, might not happen, right? MD Pathology, Transfusion Medicine. The one good thing about Transfusion Medicine is you can be a part of a bone marrow transplant team. The opportunities of bone marrow transplant as of now in our country is not so well defined. So I would say MD Pathology. A known devil is better than an unknown angel. I don't know what will happen in future. Again, Misha, taking a drop is your personal call. So if
that you have to take it because you have your own circumstances. I cannot comment on the circumstances. You take a drop, you don't take a drop. Decide if you're going to take a drop. If you're going to take a drop, this is for everyone. If you're going to take a drop, don't say that, okay, I have 6 more months, 1 month I will work, or 2 months I'll work part-time, then I'll read for the next. If you do that, definitely the rank in the next time will not be good. So if you're going to take a drop, decide to yourself, tell to yourself, next 6 months I'm going to give my 100%. Only then the rank will improve. And yes, definitely rank will improve if you have your full heart there, not part here, part there. Fine. Good private colleges, definitely is good. Go medical college, if Advaita, like, I would say it's not bad. Again, is there any preference for Goa Medical College? There are much better medical college. Why? I don't know why you ask for Goa Medical College. Bindu, Manipal, KMC generally it goes very well ahead, like around 5,000, 6,000, it will be done. Okay, NEET PG aspirant, color blindness is different, color deficiency is different. If you are color blind, like I cannot see what is pink or what is blue, it is difficult, right? You know, I think it's a disqualification criteria as well. Color deficiency is not a problem, right? I am also color deficient, right? I can see pink, I can see blue. I cannot see the exact shades of pink and blue. See, color deficiency is different. There are like red-green color deficiency is a very common one. So that is not a disqualifying criteria to enter into pathology, and you will not be like you will definitely be able to see slides and you'll be able to diagnose, right? I am still diagnosing. I have not felt any differences or difficulties in diagnosing with the color deficiency what I have. Okay. Yeah, definitely. Niriksha, you can read it through fellowships. Fine. If you're Goan, yeah, it's a good one. But if it's possible for you to go a little bit above for Mumbai, any good colleges, that will be better one option than Goa Medical College. That's all. These are a few things which I haven't which I personally know. There are lots of things I may not personally know in different states. If you want to know about any particular state, any particular college, just let me know. I have a group of colleagues who work in different places of the country. I'll be able to guide which will be better for you. All these colleges in Tamil Nadu are good. Okay, I'll come to it, Dr. Shush. Karnataka, St. John's, I would put it upper than Bangalore Medical College. And KMC Manipal, the only thing about Manipal is the money. It's a bit expensive. If you're okay with that expense, Manipal will be the first, then St. John's, then Bangalore Medical College. Fine. Kerala, Amrita is good than Trivandrum, but Amrita again, it's the expense. It will be expensive. Otherwise, all three are equally good. Fine. UP, SGPJ will be the first, because SGPJ has few, it's like a central institute, like you have tiny subdivisions. Whenever you have lots of super specialists doing there, the pathology in that hospital will be very much refined, right? LLRM, keep it last. SGPJ and KGMU, whatever you want, go with it. I would personally prefer SGPJ having a little bit of an upper hand than your KGMU, because SGPJ also has renal path fellowship. If you can go outside, that if you want a fellowship, definitely an internal candidate will be preferred. Fine. Yeah. Maharashtra, I will talk about this. KM, TMH, Topiola, all of them are good. Grant will fine. TMH, the one problem where few students talk about is, I'll come to it, Lena. One problem what few students tell is that TMH is only oncopathology. Will I not be able to diagnose anything apart from oncopathology? First thing, when you're going to go to TMH, you'll have peripheral postings in KEM to diagnose, to understand and to deal about non-onco things, right? And when I have an oncopathology, like an hospital which is completely dealing with oncopathology, for example, I worked in a hospital which is completely dealing with onco, doesn't mean that every person who comes there will have a cancer. Let's say there is a person coming with a breast mass, it could turn to be fibroadenoma. It need not be always be cancer. So you will see non-neoplastic conditions also. It's not that only 100%, only the referral things will be known case of cancer. And in referral cases, you won't have biopsies. The person who walks in may have cancer, may not have cancer. So yes, working in TMH, you will have a little bit of exposure to non-neoplastic conditions also, but to take care of other things, you will have a peripheral posting in KM. So that alone should not be a disqualifying criteria. Okay, I'm not going to go to TMH. Last year, the first seats which went in pathology went to TMH. TMH is a very, very good place. Please go with that. Siddhartha Medical College, Tumkur, Krish, not a personal fan of that. Fine. AP in Telangana, Abdul, Osmania. NIMS is a good institute. Osmania is NIMS. Again, NIMS has fellowships of opportunities. So if you have an idea of fellowship, go to NIMS, then Osmania, then Gandhi. Fine. Orissa, AIMS BBSR is a very good place if you are still in dilemma with the upcoming university if you're going to give, or any of your friends who are going to give. AIMS BBSR is a good place, and Kalinga Institute is a good place in Orissa. These are the few things which I know in Kolkata. TMH again, the same thing, no dilemma, it's going to be only onco. You will have non-onco push also. Fine. These are few things which comes to the top of my mind when I think about DNBs. Every Apollo hospital is good. I might have missed a few because these of them I personally know. I personally know students there. I personally know consultants there. So these I can assure you they are good. If you have any other hospital in mind, as I said that, please ping me the hospital. If I know anyone there working there, I'll connect either both of you. I'll ask them and say how it is. Fine. All these hospitals mentioned here are very good. Okay. Aishwarya, saturation is there in every job. Like I said that its saturation is more crowded in a metropolitan city compared to a second tier city. You will definitely come out of saturation. That should not be the only thing which is going to pull you away from PATO. Fine. Belgaum is a good place, Krish. Siddhartha was Belgaum, I'll say go through Belgaum. Abdul, as I said that the ranking of a place, right? The ranking of a place, what happens is it is totally dependent on, it's lots of skewed things are there. I know people working there, so the load I know, the way they diagnose I know, so I believe that the DNB also will be good there, that's all. Fine. I will have to get back to you on that, Babita. Fine, just ping me once, I'll have to get back on to it. Fine. Okay. So these are a few things which I wanted to convey to you guys. So if you have any more queries, it's open to ask. You can ask any queries if you have in pathology. Niranjan, AIMS Delhi was a JIPMER. See, I am a JIPMERite, so I'll be a little bit biased towards JIPMER. But if you're getting in AIMS Delhi, the reason why AIMS, I would prefer AIMS is AIMS as a tag. You can get into super specialty. You have lots of fellowship in AIMS. You have DM in AIMS. So getting into their own college is a bit easier. So that reason, yes, I would prefer AIMS Delhi. But JIPMER will have a better teaching place than an AIMS Delhi. But JIPMER, the opportunities of going abroad will be a little bit less. When you have a degree from AIMS Delhi, it's recognized all over the world. So that will have a heavy weight. It's more of the tag. Fine. Actually, most of the Delhi colleges are good. I don't want to use CMS, VMMC, MAMC. All of them are equally good. Rohtak is fine. If you're getting some college in Delhi, I would prefer that. Then if not, you can go with Rohtak. Rohtak is not a bad college. Anushri, 5836, is it worth taking MD Pathology over clinicals? Again, it's your call. If you want to see patients, go with that. I won't say it's a wrong decision to take an MD Pathology at 5836. Last year, I think the first person who took was around 3000 or something rank. Right? So it's not a bad choice. If you want it, go ahead with it. Fine. National Institute of Path, I am not sure about that, Himanshu. I should get back to you on that. Just ping me whatever college if you want. If I say I don't know. MS Ramaya is good. Kempagowda, I will keep it later. MS Ramaya, then Kempagowda. Okay, Shivam, if you have done an DNB, you have to work as an SR in a medical college teaching hospital to get the teaching experience. Then yes, you will be eligible for everything. At government, there is a little bit of hindrance as of now, which I believe that will be gone in the future. But private, there's no hindrance as of now. Fine. How to draw 21k good colleges rank. Like, see, you have the entire list of the allotments of DNB first round, second round, third round, AAPG first round, second round, third round. Right? Go based on that. Above 1000 ranks, below 1000 ranks, fill every colleges. Because the sliding, we are not able to sure like how much reservation will have an effect, how much fusing your MD counseling and DNB counseling will have effect. No one knows, so I'm not sure about it. Fine. Neha, Kims and Sims Shimoga, I'm not sure about them. I'll have to get back to you. BL Kapoor Delhi is the hospital, right? BL Kapoor Hospital is good. BLK is super specialty hospital. If you're mentioning that, yes, that's good. Middle East go for Path Abdul. Abdul, what happens in Middle East is Middle East has two ways of entry. One, you can finish your MD path and go inside there, or the better scope and availability to Middle East will be finish your MD path, get an experience for 3 years, then go to Middle East. Because when you go with an experience in Middle East, you'll be considered a higher rank. Others will be your junior most consultant. You'll go into the consultant range, a specialist range, when you go after 3 years. Yes, you will have a slightly exam like an NBB, like an qualifying exam by that country. You clear that, you'll be eligible for a consultant post. Middle East, yes, you do have lots of opportunities. I'd say MMC and CMC Vellore. If it's Tamil Nadu, go for CMC Vellore as well. And yeah, MMC, Stanley and others later down the road. I would prefer DNR Mangeshkar over BGMC Pune. It's a personal choice. Please go and have a look at both of the places. If you prefer one of the above, please go with that. Sunny, it's a bit difficult to get it from Delhi. Bhopal and Indore, I'm not sure, Lina. I'll have to get back on with that. Apollo Kolkata is good. Chitrajan National Cancer Institute Kolkata, I'm not sure about that. I'll have to get back to you on that. Whatever I'm saying, get back to you. Please give me the hospital name, ping me on Telegram or Instagram or WhatsApp. I'll be able to get back to you on it. Right? Anu Kerala Hospitals, Jubilee Hill, I think it has MD as DNB. That's good. Amrita is good for MD. DNB Hospitals, I'm not exactly sure about Kerala. Again, I have to get back to you on that. Anidita, like for any peripheral college, not only in West Bengal, any college, I would prefer it later down the road. Central college in a center, then a DNB hospital, then a peripheral college. Okay. Epicness overloaded, I may be a bit biased on this again. I would prefer Apollo Chennai versus Osmania, because Apollo Chennai, as I said, that it has everything on under the roof. Till next generation sequencing is there, they are reporting next generation sequencing, so we'll go ahead with it. Fine. Anonymous, as I said, that getting a job, see, this is a problem. You have to understand how it works, right? You are seated here and you say that I can travel up to 10 kilometers only, right? In 10 kilometer radius from your place, getting job for any specialty is a bit difficult, right? It's not coming outside, no one is going to give you an offer letter. If you can move outside a little bit, jobs are definitely easy. It's not only for pathology, any fresher, you will get placed somewhere, but will you like the job? I cannot assure you that. In every metropolitan city, I also told you that there is saturation, but again, if you're a little bit loose on the locality, if you want to go outside, you can definitely get a job, right? Okay, Niranjan, MD radiation oncology versus pathology, both are two different different fields. A radiation oncologist will be a better person to comment on that. Generally, yes, not only in JIPMER, in most of the places, MD radiation oncology and pathology goes in that. Fine. Okay, Shreyansh has given us an input of AIMS Jodhpur is good. Yeah, if you are from that college and if you know about the pathology department, you can go ahead with it. Sami, Maharashtra, I did had a listing regarding Maharashtra. Can go with that. KM will be the TMH if you're okay with TMH. Otherwise, go with KM or Uttarpurwala. Shivam, Gujarat, I'll get back to you. I do have a friend who practices in Gujarat. Just text me once, I'll connect you with him. You can ask him everything about pathology in Gujarat. See, Sunny, I should not be commenting on what your question it is. Like, there are many things which are illegal in our country. A technician cannot own a lab, but most of the labs are owned by technicians only, right? So it's the economics of medicine which is going to come into play, right? That's the reason it's still there, fine. Yes, Rajat, that is a main concern here since they have changed the pattern. We are not sure how the question is going to be. If it is going to be predominantly medicine based, clinical hemat will be difficult for pathology, pediatrics as well as your biochemists to enter into clinical hematology. And I don't know how frequently NMC is going to change that. So as of now, yes, it will be a bit difficult. Okay, Disha, immunohematology and blood transfusion, you can work in a blood bank one. As I said previously, you can be a part of a bone marrow transplant team, but it will be a bit difficult to get into it because in our country, we don't have so much of places doing bone marrow transplant. There are very particular places and they have a well established team already. So getting into it, you should do a fellowship or something, then you can get into it. Ramachandra is good. PSG is good in Tamil Nadu. I'm not sure about Shreyansh. MD Ames Delhi. I have to look at this year's counseling to tell you about it. Yeah, Kidwai is a very good place, Smriti. If you can get in Kidwai, again it's more of onco based, but Kidwai is a good hospital where you have almost everything available and they have a good patient load as well. Shivam, just do it on Instagram at Ranjith AR. You can do it. Okay, Sai, fine, I'll add to it as well. Fine, if WIMS is good, if you are from that college, you'll have a better idea than me. I have included college only which I have an idea, which I don't have an idea, I have not put it there. Fine. Sandeep, peripheral in the sense like since I'm from Tamil Nadu, I can say Chennai is a center college, like Madurai is decent. Tamil Nadu has down south Tirunelveli Medical College. Those things I'll consider peripheral, which is a little bit away from your metropolitan city, that's all. I don't have an app to guide PG resident. I have classes in Unacademy for PG residents, which we have started of late. We are doing with endometrium. We'll definitely do everything for you guys. Whatever in our portion is there, I'll be able to teach with whatever slides I have from our colleges, and I will go with that. Fine. See, Sai, I wanted to say this for everyone. Academics not being good, right? Please, this is not for only for pathology. Okay. It's not only for pathology. Keep this in mind. This is for every specialty. Every specialty, actually in MBBS itself, they won't teach you. Right? It's college. It's not like a school. When it comes to your post graduation, any specialist, they'd expect you to do your own job. They'll expect you to read. They expect you to ask questions. When I come to academics, they will not come and sit you and teach you, okay, this is how. If you read, if you see slides and then you ask a doubt, they'll definitely answer. If they're not answering, then yeah, academics is poor. You can't expect any of the MD field for you to sit and teach like what they did for MBBS. You won't have a curriculum. You won't have that, okay, 1 hour class in pathology and microbiology, 1 hour in medicine surgery. You won't have like that in MD. So with that alone, you can't say academics is poor. Then I would say that every college from head to foot, academics is poor. Academics coming to MD or MS, you have to do your own homework. You have to read. When you have a doubt, you ask, then they will definitely clarify. Fine. Ankit, I really don't know about it. This totally left to your legal system to handle that. Yes, it is very, very rampant. The digital signature being, like you said, in different city, different very, very far off places, they can sign still. Let's see what future holds. Okay. Fine. Okay, if there are no more doubts, we can call it a day. As I said that, if you have any more doubts regarding any college, you can ping me on Instagram. I'll be available at Ranjith AR. Okay. Fine. We'll do it in person. Shivam, it's not like you're going to come after 3 years, so I'm not sure what will be the scenario after 3 or 4 years down the road. As of now, yeah, some fellowships might be required. Even after MD Pathology, you will have an opportunity, but most of the corporates are preferring fellowships because they are subcategorized. A GI team wants a GI pathologist because a GI pathologist will be able to give a better report than a general pathologist. So maybe in future 5-10 years down the road, that might be a scenario where pathology also requires super specialization. Fine. Yeah, if you're an MD pathologist, if it's your own lab, yeah, you can sign. Sunny, I'm not sure your rank. You have to look at your previous year allotment list and just have a look. Fine. Okay. Thank you for your time, guys. See you soon. If you have any doubts, you can ping me on Instagram, or there'll be a WhatsApp number. You can ping to that as well. Just put your query. Okay. You can ping to any of this. I'll definitely make sure that every day by night before sleeping, I'll answer most of your queries, right? If I miss anything, if I'm not answering the queries for the next day, just put a question mark or a hi so that it comes on the top again. I'll be able to reply. Fine. Thank you for your time. Bye-bye. Cheers and best of luck. Study Medico, MD Path. If you're in the cream of the colleges, go with MD Path. DNB also, Stevens, Gangaram is very, very good for DNB as well. That's left to you. Fine. If you get both, since the sigma of DNB is a little bit there, I would say go with MD Path. Fine. Thank you. Bye bye.